It is so important for me to be part of this community program. I love the partnerships with a faith-based organization. You have the HEAL Collaborative that has other critical partners. We need to find a way to do better community outreach and education to a lot of our low income, but also our racial and ethnic populations that may have lack of access to healthcare. So when you have lack of access to healthcare, you have lack of access to getting any health education, having the ability to someone to answer your questions and talk about your concerns. I think the number one misconception about lung cancer for at least people of color is that they may consider this as more of a white person's disease as opposed to they being impacted by lung cancer. Other issues that I think there's concern about is that sometimes they think the treatment of lung cancer may be spreading the cancer as opposed to curing the cancer. So there's so many myths that we really need to address in our communities. So I think that if I had to advise someone about what are the first steps in order to get themselves screened for a low-dose CT scan, which is the current recommendations now for anyone that's been a smoker for 20 years, at least 20 cigarettes a day, or 2 packs of cigarettes a day for 10 years, they need a primary care provider, preferably, but they can, if they don't have one, they can contact any federally qualified community health centers. They can contact their local and state health departments for referrals. And then we have a number of cancer agencies like the American Cancer Society. I currently right now chair the Indiana University Simon Cancer Center Advisory Committee. And we have so many partners there locally here that can help any individual, provide them some pamphlets and materials, and sometimes hold their hands, helping them to make that appointment for them. So I think that's so important that you need to have an idea of understanding that sometimes precision medicine is important and critical, meaning that because of your genetic makeup, some cancers that you have may respond to certain drugs better than just a one drug treatment fits all. But if I had to say anything, the most important thing is lung cancer cells can double in a month's time. And so for us, sometimes we take our time about making decisions, and I'm not talking about taking our time about making decisions, I'm talking about months. It may take us to make a decision when you don't have that time. You could save your life hugely, but you have to be able to respond quickly. You have to be able to have the ability to do your own homework. You don't depend on just your doctor telling you everything. Check things out for yourself. And if you feel you're not getting the information where you can understand it, find another provider. No problem, get a second opinion, okay? There is some trusted primary care provider or someone in the healthcare field. Talk to your local medical society. National Medical Association is the largest Black physician group in the country. We've been around since 1895. We were the ones on the plane with Lyndon B. Johnson to sign in the Medicaid and Medicare Act. When the American Medical Association says, no way, we don't think it's a good thing, and they refuse to sign. We were on Air Force One with Lyndon B. Johnson, our president of the National Medical Association, to sign for that. Now you tell me, who doesn't benefit from Medicare and Medicaid in this day and age? So we have local societies in almost all the major metropolitan cities. You can contact us locally for information, or even our national website, or your local health department director, such as myself, okay?